Like many other words, terminology within anatomy is made up of prefixes, root words, and suffixes. So we can sometimes have a prefix in the beginning and then a root word. We can have a root word and a suffix at the end, or we can have a prefix, a root word, and a suffix. By understanding these common prefixes, it'll help us to better decipher new terms that we see. We're going to talk about two types of prefixes that we see commonly in anatomy. These are numerical and directional prefixes. We have prefixes that mean 1, 2, 3, and 4. Uni means one. As we know, a unicycle has one wheel. Something that is unilateral is found only on one side of the body. Di and bi both mean two. I don't expect you to know which one to use in which circumstance without understanding the context, but you should know that whenever you see di or bi, it means two. So carbon dioxide has 2 oxygen atoms. A biceps muscle has 2 heads. Seps means head. Tri means 3. Therefore, your triceps has 3 heads. And quad or quadra means 4. We've heard this before with quadrilateral. We'll see it again with your quadriceps muscle group. So as you can see here, just by knowing our prefixes, if I tell you what the word seps means, you can now tell me something a little bit more about your biceps, your triceps, and your quadriceps muscles group. You don't know where they are yet within your body or what they do, but you can tell more about them. And even if I gave you a picture of them, without knowing where they are in your body, you could still see which one has 2 heads, that must be your bicep, which one has 3 heads, must be your triceps, and which one has 4 heads, must be your quadriceps. Moving on to directional prefixes, we have a list of different prefixes, and they will tell us where something is in relation to something else, usually in relation to the root word. We'll start with infra. Infra means below. So something that is infrapatellar is below your patella or your kneecap. Sub also means below. Again, I used sub with patellar, and so subpatellar also means below your patella or your kneecap. Again, I won't need you to know when to use infra versus sub in this case, but if you see infra or sub, you should know what they mean. Certain things do have certain names. These happen to both be names of bursa, or little fluid-filled pouches that help cushion your joint, but you don't need to know exactly where they are right now. Just know that infra and sub both mean below. Next, we have a pair of prefixes, inter and intra. Inter means between or among. We see it here with interosseous. Interosseous means between the bones or between 2 bones. So we have interosseous membrane, which goes in between 2 bones. You may have seen it in other places. For example, something that is interdisciplinary means between 2 disciplines. Maybe we're combining science and economics for something that is interdisciplinary. Intra means within. Something that is intramuscular is injected within the muscle. We've seen inter and intra as well with sports. Intramural sports are played within the same college. You have a bunch of different teams, you're all playing at your university, you're not playing against anyone that doesn't go to your school. Versus our league in New Jersey is the NJSIAA. The I stands for interscholastic. In the NJSIAA, we are playing against other teams. Ipsa means same. Something that's ipsilateral is on the same side of the body as something else. Post means after or behind. Post-mortem is something that is done after death. Pre means before. A pre-participation physical is conducted before you participate in sports. And lastly, we have trans. Trans means across or through. Something that is transcutaneous goes through the skin. So for example, perhaps you've heard of a TENS unit or electrical stimulation. It's used for muscles, and so it actually sends little electric impulses through your skin. It's transcutaneous to get into the muscle. Here are a few different examples for you to think about. These are all different ways that medication can be delivered. We have sublingual medication, transdermal, and intramuscular. You may just know what these words mean, or you can look at these charts, a chart of the prefixes and a chart of the root words. So again, we have some of the words we just had, intra, sub, and trans, and then we have 3 different root words. Lingual is pertaining to the tongue, muscular is pertaining to the muscle, and dermal, like cutaneous, is pertaining to the skin. So if I were to tell you that that a medication is a sublingual medication, you would look at these 2 charts and you would know from your understanding that a sublingual medication is delivered by putting it below or underneath your tongue. A transdermal medication is administered through the skin. So this would be something like a medication patch that you put on your skin and the medication is released into your body that way. Lastly, we have intramuscular, something like an EpiPen or vaccinations, not all vaccinations, but the ones with needles, are intramuscular. These are administered by going intra within the muscle. So we inject these directly into a muscle. These are some common examples of numerical and directional prefixes used in anatomy and how we use them.